Welcome to MED-MYSTIFY. Today we are exploring an absolutely fascinating powerhouse system within the human body, sex hormones. These aren't just your run-of-the-mill molecules. They are literally the fundamental architects of human biology. From conception and embryonic maturation, right through puberty and into our overall well-being as adults, the biological stakes here are just incredibly high. We're talking about regulating your energy, your moods, your bone density, the whole shebang. It's this brilliant, intricate chemical dance, and today we're going to break it all down for you.
To start us off, we really need to understand what we're actually looking at. Sex hormones are powerful chemical messengers. They're synthesized mostly by the gonads, but here's the thing. They don't just float around causing random chaos. Their activity on target cells is strictly regulated by receptors. Think of the hormone as a highly specific key, and the receptor is the lock. Without that exact receptor on a target cell, the hormone just can't function. It's this incredibly precise lock-and-key mechanism that dictates everything from early embryonic development to cellular aging. So here is our roadmap for today's explainer. First up, classifying the hormone families. Second, we'll dive into androgens, specifically looking at testosterone and nandrolone. Third, progesterone, which is basically the ultimate pregnancy preparer. And finally, we'll wrap up by breaking down estrogens, both the natural and synthetic kinds.
Okay, let's jump right into Section 1, classifying the hormone families. We're going to focus on the divide between the naturally occurring molecules and their synthetic derivatives.
Let's pull this apart. We're separating out our three main groups here, androgens, estrogens, and progesterone. On one side, we have our naturally occurring endogenous hormones, stuff your body makes, like testosterone, estradiol, and natural progesterone. But right alongside them are their synthetic drug counterparts, engineered in pharmacy labs. So we've got synthetic androgens like methyltestosterone, synthetic steroidal estrogens like ethinyl estradiol, and synthetic progestins like levonorgestrel. Understanding this divide is absolutely crucial because modern pharmacy relies so heavily on these synthetic tweaks to alter things like how long a drug lasts in your body or how powerfully it binds to those lock-and-key receptors we just talked about.
That brings us to Section 2. Let's look closely at our first major family, the androgens, which are basically the biological builders of the body.
Now here's where it gets really interesting. It's all about biological crossover. When we hear the word testosterone, we almost always think, right, strictly male. And sure, in males it's essential for reproductive organs and those secondary sex characteristics like a deepening voice and facial hair. But take a look at the female biology side. Females form testosterone too, just in lower quantities in the ovaries and adrenal glands. And they crucially rely on it. It drives libido, mood, energy, and it offers vital protection against osteoporosis by helping maintain bone density. So it's really a foundational builder for absolutely everyone, just in different amounts.
So how does this actually work biologically? Well, step 1, it activates the androgen receptor, either directly or by morphing into a much more potent version called DHT. But check out step 2. It doesn't just stick to its own receptors. Testosterone actually converts into estradiol in the body, which then goes on to activate certain estrogen receptors. It's an incredibly versatile molecule. It literally borrows the pathways of female sex hormones to complete its own biological signaling. How cool is that?
Clinically speaking, drugs like Getenzo are commonly used as replacement therapy for males dealing with hypogonadism, which is basically reduced endogenous testosterone. But they also have this really surprising palliative use in treating advanced inoperable breast cancer in postmenopausal women. That being said, this hormone therapy comes with some very distinct side effects. Because it's such a potent builder and causes a massive hormonal shift, patients can experience significant weight gain, severe acne, dry mouth, and, ironically, male breast enlargement.
Let's look at a synthetic derivative of testosterone now, nandrolone. You might know it by its trade name, decadurabolin. This is a synthetic anabolic androgenic steroid, and because of how it's structurally engineered, you actually can't take it by mouth. It has to be administered via injection directly into the muscle or fat. Why? Because that allows it to completely bypass immediate breakdown in the digestive system and liver.
The big takeaway here is that this synthetic builder is incredibly effective for some very severe conditions. It's used to treat cachexia, which is a severe wasting syndrome, along with anemias and osteoporosis. But there's a heavy trade-off. It comes with intense, virilizing side effects. We're talking chills, impaired liver function, and physical changes like hirsutism, which is excessive hair growth, and even a permanent deepening of the voice. Let's shift gears now to our third section, focusing on our second major hormone family, progesterone, the ultimate pregnancy preparer.
Progesterone is the main progestational steroid, and it has some pretty powerful origins. It's released primarily by the corpus luteum right after ovulation, and then later in massive quantities by the placenta during pregnancy. But what's truly fascinating is its wide range of targets. Yes, it works directly on the uterus to prepare for a fertilized egg, but it also targets the mammary glands, and significantly, it targets the brain, where it actually helps with relaxation and reducing anxiety. Its mechanism of action is kind of a biological paradox. Step 1. It binds to the progesterone receptor. Step 2. It modulates gene expression to proliferate target tissues, literally building a supportive, lush environment in the endometrium for an embryo. But step 3 is where we see its dual nature. While it sustains an existing pregnancy, high levels of progesterone can actually prevent a new pregnancy from happening. It does this by thickening cervical mucus to block sperm and by inhibiting follicle-stimulating hormone, or FSH, which essentially hits the brakes on ovulation entirely.
In pharmacy, medications like prometrium are widely used in assisted reproductive technology to support early embryo implantation. They're also prescribed to treat secondary amenorrhea and abnormal uterine bleeding. But, as you can imagine, when you're modulating the brain and the uterus at the same time, you're going to see side effects. Patients often report abdominal cramps and bloating, right alongside significant emotional lability, dizziness, and even depression.
All right, let's transition to our fourth and final section. We are going to explore the distinct and varied roles of estrogens, the true, potent powerhouses of the hormone families. The human body is incredibly smart about how it shifts its natural estrogen production through different phases of life. First up, we have estradiol. This is the most potent form, and it's the major female sex hormone circulating during those childbearing years. Then, during pregnancy, the placenta takes the wheel and produces massive amounts of estriol. Finally, after menopause, the body actually stops making estradiol entirely and shifts over to estrone, which becomes the only natural estrogen the body continues to produce later in life. And this brings us to a major crossover surprise in pharmacology. We all know estrogens are used in females to treat menopausal symptoms, vaginal atrophy, and to stave off postmenopausal osteoarthritis. But take a look at the male uses. High doses of estrogens, like estradiol and estrone, are actually used as an active, powerful treatment for men battling advanced, androgen-dependent prostate cancer. It's a really incredible example of how shifting those hormonal balances can literally suppress cancer pathways.
But because these are such potent powerhouses, the clinical side effects can be quite severe. Healthcare professionals have to constantly monitor these patients for issues like intense breast pain and tenderness, unexplained excessive vaginal bleeding, sudden weight gain, and significant edema, which is basically severe fluid retention and swelling, usually in the face and limbs.
To close out our drug review today, I have to highlight diethylstilbestrol, or DES. This is a non-steroidal synthetic estrogen. Now, it was formerly used to prevent miscarriages, and it's actually still used in some cancer treatments today. However, it is absolutely notorious for its side effects. To put it into perspective, at doses of just over 1 milligram per day, patients experience a massive 15 to 50% incidence rate of severe bloating, abdominal discomfort, and nausea.
Which kind of brings us to the very edge of modern pharmacy, with sex hormones regulating absolutely everything from our daily mood down to the physical density of our bones. The margin for error is razor thin. So how will future synthetic drugs further refine this delicate biological balance? How do we maximize those life-saving benefits while completely eliminating those intense, heavy side effects? I mean, it really is the ultimate puzzle for the next generation of pharmacological engineering.
Like, subscribe, and share this with your friends for such more pharmacy-related informative videos. Be sure to write your queries in the comments section. We will catch you in next one.